it hit really fast. I mean, it was just like, wow.
Unprecedented.
A global disease for which we really had no information.
Tremendous stressors.
Our pediatricians were drowning.
Lots of burnout.
Children just lost.
Fear of not knowing what was going to happen next.
We're in crisis mode.
The COVID-19 pandemic swept across the world in early 2020, uprooting every aspect of how we live. Throughout it all, the American Academy of Pediatrics was laser focused on keeping infants, children, teens, and young adults healthy and safe.
It was amazing how the AAP stood up and took the lead.
The way that the American Academy of Pediatrics approaches any topic is to ask two central questions. What do children need, and what do pediatricians need in order to take care of them? And those were the two questions that drove us through every aspect of this pandemic.
Physicians, nurses, and others in healthcare worked tirelessly to keep families and children safe. At the same time, they had to balance taking care of themselves, their families, and their colleagues.
The pandemic really taught us as healthcare professionals how vulnerable we really are in taking care of patients who might be sick with an illness for which we didn't really have answers, and we didn't understand exactly how this disease might impact not only the patient but our own workforce, ourselves, and our families.
There were moments of real inspiration where people stepped forward in ways that were totally unexpected and that we didn't know that we needed. One of the stories that I remember is of a pediatric emergency room physician who was going into the hospital every day to take care of adults. It was unclear what her risk was for COVID, and so in order to protect her family, she slept every night in the garage, and she did that for a very long time. That's the kind of story that was routine in this pandemic.
In 2021, our members watched health officials approve the vaccine for adults, then teens, then finally the youngest of our population. The challenges of COVID-19 were not to be forgotten, as contagious new variants like Delta and Omicron stressed the hospital system.
I think there were two things that we tried to do as AAP and that I tried to do as president. First was to really make sure people had the information and the tools they needed to respond. We also at the same time really advocated for them. I mean, we were out at the federal government, we were talking to state governments, we were talking to the media, we were talking to anyone who would listen, to let them know that, and to really push for things that would help pediatricians to be able to provide the best care that they could.
While the wait for the vaccine was day by day and month by month, this amazing scientific and medical accomplishment was 40 years in the making.
What a miracle these vaccines were. The mRNA technology had been in development for 40 years. And this just happened to be available and ready to go when the pandemic hit. We were so fortunate. And to me, that was, I say it's a miracle, which makes it sound like magic, but it was really a miracle of timing that it was ready to go.
A really important piece was ensuring that as the vaccine was available, it was also available to everybody, and that access to the vaccine was available in an equitable way.
With officials declaring an end to the emergency phase of the pandemic, how are children doing now?
Kids have been through a lot over the past few years, and I think it depends how they're doing now. I think some kids are doing better, right? They've got some good stability, and they learned over the past few years, and they're starting to do better. I think some are really still struggling. The impacts of the trauma of the past few years have been profound.
Really realize that there are children who missed a lot of school, and they're behind, and to get them caught up is hard. Yeah. There are children who suffered more mental health issues, especially with family loss. They lost family members, and so I think we're still in that process of recovery, and children are better than they were in 2020 and 2021, so. But we still have a long way to go.
We do.
We say all the time that children are not small adults, and that's true. You can't fit children and families into an adult system. So as we think about rebuilding the things that were harmed during COVID-19, public health systems, community services, the whole pediatrics healthcare capacity, we've got to strengthen those. And then as we think about future pandemics or respiratory viruses, we need to remember that we have to start with the children. If we get it right for children and families at the beginning, we'll get it right for everybody else.